How is cervical cancer being eliminated worldwide? Imagine a world where fewer women face the fear of cervical cancer. That vision is becoming a reality through a global effort focused on three main strategies. The first is widespread vaccination against human papillomavirus, or HPV, which is the main cause of most cervical cancers. Vaccinating girls before they become sexually active helps prevent the high-risk HPV types that lead to cancer. The goal is to reach 90% vaccination coverage of girls by age 15. These vaccines are proven to be safe and highly effective at preventing infection with the types of HPV most associated with cervical cancer. Increasing access to vaccines, especially in low- and middle-income countries where the burden is highest, is key to eliminating the disease. The second pillar is cervical cancer screening. Screening helps catch precancerous changes early so they can be treated before turning into cancer. The target is to screen 70% of women by age 35 and again by age 45. Tests like HPV DNA testing and pap smears are used because they are accurate and affordable. Organized screening programs have already reduced cervical cancer deaths by up to 70%. Expanding these programs and making testing accessible in underserved areas is essential to reach more women and save lives. The third pillar is ensuring women who are diagnosed with cervical disease receive proper treatment. This includes removing precancerous lesions and managing invasive cancers with surgery, radiotherapy, or other appropriate care. The aim is for 90% of women with cervical disease to get the treatment they need. Improving access to quality treatment services is vital to lowering mortality rates and helping women recover. Countries around the world are integrating these strategies into their national health plans. International groups like the World Health Organization support these efforts by sharing innovations, mobilizing resources, and encouraging political commitment. Events like the Global Cervical Cancer Elimination Forum bring together governments, organizations, and funders to accelerate progress. A major focus is on equity, making sure that women in low-income regions and vulnerable populations can access vaccines, screening, and treatment. Without this focus, disparities will continue and the goal of elimination will be harder to reach. Modeling studies suggest that if these three strategies are scaled up to the targeted levels by the year 2030, nearly 40 million cases of cervical cancer could be prevented, and over 35 million lives saved within a century. But if efforts are not increased, the number of cases and deaths could rise. So, the coordinated global effort to eliminate cervical cancer is based on proven prevention, early detection, and timely treatment. With strong political will, international collaboration, and a focus on fairness, cervical cancer could become the first cancer to be eliminated as a major public health problem worldwide. Always remember, for personalized advice or treatment options, consult your healthcare provider.